Hello everybody, it's Scott, the Home Health Hustle Nurse here, and today I'm going to talk about the top 5 biggest surprises that I discovered when I switched from the hospital and moved into home health. So the first thing I found surprising when I switched over to home health is that nurses have to touch billing. I'm trained as a clinician, not a medical biller or coder, and I don't feel like I should be having to touch any of that. The next big surprise is that stat doesn't mean stat in home health like it does in a hospital. So I have a background in cardiac and emergency and things where stat means it should have been done yesterday, like right now, we need it. In home health, stat means, okay, get it if you can get it today, like with a lab or something. If you can get it done today, great. And then when it gets to the lab, then we'll run it as stat. The next surprise for me was that we don't do just the nursing assessment, or what most nurses are used to in the hospital. We'll do assessments for things like functional scoring, the activities of daily living. When we do visits called starts of care, which would be the equivalent to a hospital admission, we will assess those and see basically how the patient is functioning and what their prior level was. The next thing that was surprising for me, kind of a shocker, is that, and I shouldn't be surprised about this, but finding a bathroom can be really difficult, especially if you drink a lot of coffee like I do and need it quite often. And some gas stations won't even let you use the restroom, which is rude. And some patients won't even let you use their restrooms. And some patients, you don't want to use the restrooms. So figuring out if you have a territory that you're normally going to, figuring out which locations where they have public restrooms or clean bathrooms is something that normally you wouldn't have to think about when you go to work, but in home health, you got to think about that. And the last thing that was a big surprise to me was how sick some of the patients that they send home from the hospital can be, and they'll still send them home. And the biggest example I have of this, and this is not an exaggeration, I had a patient discharge out of the hospital on a ventilator. And when I got that patient, my manager told me I was getting him. I'm like, you have to be joking. That's not real. You're a funny guy. But he was dead serious. So, and that specific patient was on a ventilator at night. He had a trach and all this other stuff, but it's not just wound vacs or PICC lines or things that are kind of a long-term treatment. Some of these patients are really sick and have some really acute needs. So that was also a big shocker. So if you've enjoyed this video, don't forget to like and subscribe, and check out the Home Health Hustle Nurse channel for other videos. So if you and some bathrooms won't even let you use their restrooms. So I don't understand how you can be a gas station. Whoa. What?